session here, taking the topic on respiratory, renal system changes, and weight gain during pregnancy. So, weight gain during pregnancy. Total weight gain is around 12 kg in the pregnant females, and the net weight gain is just half of it. It's 5 to 6 kg. It all depends on the racial features, on the ethnicity, on the preconception weight, on the socio-economic status, and the parity of the female. Generally, in the multiparous female, the weight gain is more. And total water retained in the pregnant females is 6.5 liter, which is contributed by the physiological edema is in which you can observe the physiological pitting, and the plasma osmolality decreases as there is a very large amount of water in these pregnant females, and the concentration of sodium and potassium is of no meaning because water is more, so sodium retention is of no meaning here in pregnancy. BMR increase during pregnancy 10 to 20% cases, 10 to 20% case. Okay, oxygen consumption increase during pregnancy. Now in the normal pregnancy and in the twin pregnancy, these two tables are very important for exams. Okay, for NEET PG as well as for INSA. Twin pregnancy and a normal pregnancy, their BMI and the weight gain in them. So in a normal pregnancy, underweight is less than BMR when the BMR is less than 18.5, and a weight gain for them is 12.5 to 18. That means the female is asked to have the weight gain equal to 12.5 to 18 kgs if they are underweight. If they are having are in the normal range of weight according to the BMI 18.5 24.9 in between, then they are asked to gain weight 11.5 to 14 kgs, and if they are overweight they are asked to gain 7 to 11.5, and if they are obese more than 30 bmi or equal to 30 bmi they are asked to gain weight less than 7 kgs to avoid the complications which can may even hamper the fetal growth or can lead to varieties of problems in the pregnancy also, and complicate to avoid the complications in pregnancy basically. Okay, so BMI, again we are revising this, like in underweight less than 18.5, it between 12 to 18, so 18.5 is 12 to 18, 18.5 to 24.9, which is a normal BMI. In this range we have to gain weight 11.5 to 14 kg, 11.5 to 14 kg, and for the overweight more than 25 to 29.9 it is 7 to 11.5, and then less than 7 in obese females. In the twin pregnancy, the weight gain is like in the normal range. When the female is between 18.5 to 24.9, the weight gain is 5 to 10 times more that of the normal pregnancy. And in the overweight, it is 7 to 11 more, and in the obese, it is 5 to 12 more. How can you remember these? Okay, so just remember like normal, overweight, and obese. Okay, so it is 5 and 5, and in between the 5 there is 7 and 10, 11 and 12. So these are the weight gaining during pregnancy. So you just have to remember the normal pregnancy range and the weight gain, and you will automatically learn this twin pregnancy range. So again, revise this normal pregnancy weight gain ratio is very important. Again, I am focusing on the twin pregnancy range. Normal 5 to 10, overweight it's 7 to 11, and obese it's 5 to 12. For the normal category, the weight gain is 5 to 10 more. So add 5 to 10 in the normal category 11.5. Adding the 5 in 11.5 is around 17. So it is around 17. That is 16.8 to 14, which is adding 10 is 24. Is around 24. Okay, and in overweight we have to add 7 to 11. So adding 7 is 14, and 11 is around 22, so it is 14 to 22. And in the obese, when it is more than 30 bmi or equal to 30 bmi, it adding 5 to 12. So adding 5 in in 7 is 11 around, and in and then adding 12 is 19.1 kgs. Okay, so learn this. Now the fetus dependent on the mother for glucose, thyroxine and calcium. Glucose, thyroxine and calcium. Increased calcium requirement is equal to 1200 mg, and increased calcium absorption increases the vitamin D requirement. So vitamin D RDs are very important for us to know. So increased calcium requirement, which is equals to 1200 mg, and vitamin D requirement in pregnancy is 10 microgram, which is 400 international units. For adults normally it is 100 international unit, and for children it's 200 international unit, but in pregnancy it is around 400 international unit. Okay. Now coming to the respiratory changes occurring during pregnancy. Respiratory changes, some factors increase, some decrease. There are no changes on some factors, and we will discuss about anatomical changes. So respiratory changes, some factor increase. So TIM increases. TIM increases. TIM stand for tidal volume, for inspiratory capacity, for minute oxygen uptake, and for minute ventilation. So TIM stands for tidal volume, inspiratory capacity, minute oxygen uptake, and minute ventilation. And the factor which decreases is indirectly or directly related to residual volume. FRC is related to residual volume, thus it decreases. ERV decreases. Total lung capacity decreases. Unchanged factor which remain unchanged are respiratory rate, vital capacity and IRV. Okay, so coming to the anatomical changes, please learn this changes factors which are remain unchanged. These are important for exam perspective, and also the factors which increase is also very important. Tidal volume is asked twice in the exams, and minute oxygen uptake is also asked. So please learn this point by heart. This is very important. Respiratory changes are very important for exams. Unchanged factors are respiratory rate, which has no effect during pregnancy, vital capacity, and inspiratory reserve volume. Okay, these remain unchanged during pregnancy also. Anatomical changes, there is elevation of diaphragm by 4 centimeter as the fetus pushes the diaphragm up. So it is diaphragm elevates by 4 centimeter, and the chest circumference increase by 5 to 7 centimeters. Transverse diameter of chest increased by 2 centimeter. Elevation of diaphragm by 4, transverse diameter by 2. 2 for 2 also stands also start with T. So T and T, transverse diameter by 2 centimeter. Chest circumference by 5 to 7 centimeter increases by 5 to 7 centimeter, and subcostal angle increases from 68 degree to 103 degrees. So chest subcostal angle also increases. Now coming to some renal changes during pregnancy. Renal changes, size of kidney increased by 1 centimeter, hydroureter mainly on the right side. So size of kidney increased by just 1 centimeter on both the sides. Hydroureter present mainly on the right side. Glycosuria in pregnancy is normal. So if the female, if you are doing a urine test on a pregnant female, do not uh, do not hesitate to say the female that it is normal to have a glycosuria. Okay, proteinuria is abnormal. It if the proteinuria is more than 300 mg per deciliter, it is PIH. Included in the criteria of PIH is pregnancy induced hypertension. Another bladder increase, congestion of the bladder pressure increase from 8 to 20 centimeter of H2O, bladder capacity decrease. So the only factor is decreasing is bladder capacity. Bladder capacity decrease during pregnancy, while bladder pressure increases, urethral pressure increases, and the length of urethra also increases. So pressure increases during pregnancy. Urethral pressure or either the bladder pressure, both will increase during pregnancy, while the length of urethra increase during pregnancy, and the bladder capacity is decreased during pregnancy, and there is congestion of bladder because of the growing fetus. demands more area, and the total blood flow is increase in pregnancy, increase renal blood flow, thus increasing the GFR and leading to increased clearance of urea, uric acid, and creatinine, and also serum urea, serum uric acid, and serum creatinine. Okay, and now changes in the liver will be covered in the next lecture. So, thank you for watching this video.